population, they need to go outside to find food and to find other basic services to them. It's not easy for all the people, especially those in developing countries, to stay home. Therefore, it is important, to observe all these recommendations of all this WHO and health sector's recommendations to the COVID-19. We think that in this month where the world is gathered at the UN General Assembly to discuss, the future of the world, to discuss the UN 75 years. It's very important for the, civil society to discuss on their rights, to discuss on their challenges, the challenges they are face. One of the objectives of this series of public diplomacy conferences have to do with gathering organizations from different, parts of the world to really discuss on how we work on sustainable development, how we can cooperate to implement, to accelerate, and to localize, as Ambassador Andrew says, the Sustainable Development Goals. So welcome once again. It's true that the topic we have today for you, it's a very urgent topic because the world is facing this health crisis. So it comes to our mind how people around the world are coping with all these challenges. Now I think on the access to healthcare, the access not only to the treatment or to healthcare with COVID, but the healthcare to other disease. So it's really important. Health became one of the basic rights, and it has to be taken as one of the basic rights. It has to be put at the center of the global discussion. So welcome once again. I see the SDG, the good health and well-being, as I've mentioned, as one of the most urgent SDG to be accelerated, and the voices of everybody should be heard. So thank you once again. I congratulate you for what you are standing up for what you are doing in your organizations, and welcome and wishing a very productive discussion. Thank you very much. This has first welcoming words. Thank you so much, Mr. Joseph.
Yeah, thank you so much. All right, let's just quickly take this moment to quickly do self-introduction in 1 minute of ourselves and why, yes, introduction and what we do and where we belong, kind of. Okay, I'm Humanitarian Joseph. I represent Saga Foundation. We here at Saga, part of the things we do, we localize the global idea of the 17 SDGs, which we identify, we register, we screen, we recommend NGOs that are genuine in their local area of operations or causes into the United Nations Global Compact. A great pleasure to be here. Over to you, Ambassador Janice. Please introduce yourself. Let us get to know you better.
Thank you. Thank you very much. So my name is Janice Dasira. I am a diplomatist. I've been working with the UN for 20 years. And now I've just launched the initiative, the global initiative DEF 17, that has to do with, to set up a global network to advocate for the acceleration and localization of the SDGs. I am one of the core chairperson of the IABA, the ad hoc International Advisory Board of Goodwill Ambassadors, that is led by Ambassador Andrew. And I also, am Goodwill ambassadors from different NGOs and initiatives in Asia, Africa, America. And yes, basically, it's not easy to talk about ourselves, but basically, that's the info I would like to share with you. Thank you.
Yeah, welcome. Thank you. Ambassador Andrew Williams, Prince Nanan Yao. Good. Let's have here, please, under the mic, please.
Well, thank you so very much. And I have to give a special thanks and honor to our royal patrons for their support of our project. That includes His Royal Majesty, Easy Dr. Ambassador Chakwidi Hinatu, Easy and Easy Igbo of Ghana, King of the Igbo people in Ghana, Royal Majesty Ola Easy of Ghana, Uba Owunwa, in my capacity as Prince Andrew Williams Jr., and as Nanan Yao Williams of the Akan Kingdom, which I was inducted by His Royal Majesty Nana Bafor Gwako Kofi I. So I wanted to first thank all of my royal patrons. And as you may know, I am the president of 5 Points Youth Foundation. I did put information into the chat to give you a little background. And I'd like to really invite and thank all of you for joining us, not just for the 1-year anniversary of the Ad Hoc International Advisory Board of Goodwill Ambassadors and Activists, but actually our 5-year anniversary, because 5 Points Youth Foundation, we launched this campaign to recruit Goodwill ambassadors around the world back in 2015. And we want to ask you to commit yourselves to join us for the next 10 years of the UN Decade of Action on the SDGs. So with that, Joseph, I want to thank you for this introduction, and we'll cover more of these areas in the presentation itself. Thank you very much.
Okay, thank you, Ambassador Andrew. Thank you. Over to you, Madam Patricia Angeni. Please unmute yourself.
Okay. Thank you. Good morning again. It's morning here in Canada. I'm Nigerian, but I'm in Canada at the moment. So my name is Dr. Patricia Angeni. I'm a consultant radiologist, and I am in private practice. I run the Precision Imaging Consultants, which is a radio diagnostic facility in Port Harcourt, Nigeria. So what I do mostly in my practice, where I lead a team of radiologists and laboratory scientists to screen people and diagnose their illnesses, and then refer them to other healthcare practitioners for their healthcare. So I've been doing this for the past 15 years, although I've been a doctor for 32 years. I'm married, I have 5 children, and most all of them are adults. I'm very interested in health, well-being. I have the blog called Flouricia.com, and Flouricia Speaks on Instagram, where I promote wellness and personal development. I emphasize on living life with joy, thriving with change, and being resilient. Those are some of the core values that I seek to promote in my blog. I also have a keen interest in early child education, environmental protection. I love gardening, and that's one of the things I love to do. So I'm very happy to be here to interact with all of you and put my voice on the line towards this cooperation for health and wellness. Thank you for this opportunity, Ambassador Janice, and I welcome all of us as well. Thank you, Joseph.
Thank you so much, Dr. Patricia. Over to you, Ambassador Luis.
Well, like I said earlier this morning, it's a great morning to be and to share with you the challenges that we have around the world. A little background, I'm a ex-Navy veteran with 22 years of service in the Navy and in the Navy Reserve. And in the corporate area, I worked in various companies in the operations management, project management, and security management also. As far as my career, I've also assisted in developing various nonprofit organizations, which include Global International, Ecology Crossroads, which deal with specifically United Nations SDGs development program startups. And we've been doing it for the past 15 years. I am also co-founder of Sit at the Table, which is directed to empowering women to C-level director positions. As Andrew indicated, for the past 5 years, I've been part of 5 Point Youth Foundation and recently Ad Hoc Advisory Group, which I am glad to be part of. And we have a lot of work and we have a lot of programs, but definitely it's a challenge and we will overcome. Definitely, we have a great group of people here in this conference. There is evidence of the quality and professionalism of the group. So I am very confident that we can make a difference in the world. Thank you very much.
Thank you so much, Ambassador Luis. That was a wonderful introduction. All right, Dr. Sonali, can you handle the mic and please let's get to know you better. Please unmute yourself, Dr. Sonali, we can't hear you. Okay, good.
Hello. Yeah.
Yeah, we can
you
hear
listen? Okay. Namaste. I'm from India. Thank you so much for inviting me in this fabulous session. I am Sonali Sena. I'm co-founder of my organization called parampranYog.org, operating from here near Delhi. And we actually dealing with holistic healing and holistic health conservation. So it is basically, kind of we deals in yoga, meditation, and through that we, raising the concept of holistic healing. And we are also in the philanthropic work, like we have our school, PPY School of Happiness, which is actually for underprivileged school, and underprivileged children are coming and we are giving them education, food and clothes and everything, all the amenities and stationaries. And also we are helping our orphanage here along with our organization and all. But our organization is totally kind of family-based organization, and some soulful people are connected with us and they are cooperating with us, and all over the world we are connected with so many souls, those who are working with us. And of course we are very happy to serving our society in many ways, like in healthcare also and education also. So thank you so much for inviting me here. And I'm very glad, and I would like to share more about what is holistic health conservation. Thank you so much.
Yeah, thank you so much. Thank you so much. Okay, Madam Blessing, can you please introduce yourself? Good. Unmute the mic.
Hello, everyone. My name is Blessing Ewa. I'm a public health professional and also a member of the African Institute of Public Health Professionals and the youth advocate for the SDGs and currently working with the Nigerian Youth SDGs Network. So I am passionate about health and well-being. Thank you so much.
Yeah, thank you. Ambassador Maria, can you please introduce yourself?
Yes, thank you very much, Joseph Akinola. And thank you, Janice Dasira, for inviting me again. I'm truly grateful to be included in this kind of dialogue. And I would also like to thank Andrew Williams Jr., President of the Ad Hoc International Advisory Board of Goodwill Ambassadors. I am very happy to be part of this team. I am from Sweden, and here in Sweden I work as a language consultant, and I regularly write articles about the environment for a Swedish magazine called Maja. And I am also a Goodwill ambassador for Global International that Ambassador Luis Cruz Diaz mentioned also. And we have a program called Goodwill Ambassador Foundation with many Goodwill ambassadors around the world who try to help implement the SDGs. And we also support indigenous people because we believe they have much knowledge to take care of the environment. Yes, I am truly grateful to be here, and thank you all so much.
Yeah, thank you so much. Thank you so much. Let's welcome Dr. Anmol. Anmol, please introduce yourself.
Greetings to everyone from India. I thank the host and the moderator to organize such a wonderful meet today and giving us all an opportunity to connect with each other and to know about our works in respective areas. I am Dr. Anmol Bagaria from India. I am from Mumbai, India. I have done my medical studies from prestigious Bharati Vidyapeeth University, India. I'm working in a multi-specialty hospital in India itself, and I'm also a researcher. I'm into the team of researchers. We had discovered the drug of COVID-19 in India, which is helping in India to treat patients. The drug name is ivermectin, which is given in France and India for the same. I am also a scientist in ICMR, which is Indian Council of Medical Research. We are working into research for building new things for the upcoming generations and also current diseases which are spreading across. And we are also working on this current pandemic situation, and we are trying our best to make things happen. I've also done many projects in UNICEF, UNDP, WHO, etc. I'm running currently a foundation which is called Sinodent. I'm a founder and CEO of that. We are spreading free knowledge to the doctors in India and also across the globe. In that, we are inviting speakers which are from the university heads, deans, or the owners of the university who have done their excellence in the respective fields. So we have invited them, and they are giving free knowledge. They are making doctors aware regarding the current situation. We are giving trainings to them and also free books. And previously, we have worked in the underprivileged sections of society in India. Also, we have worked in orphanages, old age home, and such areas in villages where there is no treatment available. We have designed a portable setup which can be taken up everywhere globally to provide the necessary treatment which is not given or which is not available in some areas of the country. We are also working in Sri Lanka and South Africa in SACO, which is a Save All Child organization, which is in Africa, and Sri Lanka, which is TBC. We are working globally to spread health and health awareness, health education, because I believe the children of our society are the future of our countries, and to train them, to make them aware of their health is a key towards a developed nation. And it's my pleasure to join you all today. Thank you so much.
And welcome to the team. Welcome to the team.
Thank you.
We lost Ambassador Loretta. Anyway, all right. Ambassador Janice, are you ready? Let's get to it. The topic before us is cooperation for health and well-being. Health, they say, is wealth. Let's get to it. Over to you, Ambassador Janice.
Before I continue, I don't think we did the round table because I see Lynn that didn't introduce
Lynn?
herself.
Oh, I'm sorry. I thought it's Lynn and Loretta. I'm sorry. I'm
Lynn and
sorry.
Loretta.
Yes, Loretta has just stepped out. I'm sorry about that. Sorry, Lynn.
Okay, can I go ahead?
Please introduce yourself. Yes.
Good afternoon, Ambassador Janice. It's a pleasure to be here once again. I'm so excited to meet a group of very wonderful people with the heart of doing good, with the heart of selfless service. My name is Lynn Ujagwe. I'm from Nigeria. I'm an educationist. I work with a team of managers to manage an international school. I'm the founder of the Lenzon Foundation. We're currently running two major projects. One is the Readers and Leaders campaign, where we go to low-income areas and the rural community to give them free books and educational supply. We also work with young girls to educate them on how to take care of themselves, make better decisions that will affect their future, and empower them with whichever way we can to ensure that they have a better life through education. I'm also a writer, and I'm into several things like consulting for schools and all of that. So I'm very grateful to be here. I know that I'm going to learn from every one of us as we go around with this discussion. Thank you so much.
Thank you. Welcome. Over to you, Ambassador Janice.
Thank you, Justin.
Loretta is not yet around.
Yes, she just stepped out. Okay, she is back in.
Okay, so over to Loretta.
Okay. Ambassador Loretta, can you please introduce yourself?
Okay, good afternoon, good morning, everybody. My name is Loretta Ahuokweme. I am a World Post Ambassador. I am also a change maker in World Post, and I am the Executive Director of Our Lady of Perpetual Help Initiative. We operate from Port Harcourt, Nigeria, and we work in 3 other states in Nigeria and other areas, of interest where we have interest. And our focus as an NGO is on, we have gender, we have health, we have the environment, we have peace building. And when we look at these 3 other focuses, we see that peace building and gender is at the middle of it all. So there's no way we can live a healthy life without having a peaceful environment. And environment affects health seriously. Whatever our environment gives is what.
Okay, thank you. Thank you. Over to you, Ambassador Janice. I think we lost her.
Thank you. Thank you very much. Thank you very much. I see that we have a very strong team. Talking about health is always a very challenging issue because health I see health as a very cross-cutting topic in development because we cannot work if we don't have health. Nowadays, more and more what we call in public diplomacy, non-traditional actors and stakeholders are taking, the driver's seat in cooperation for development, which I think is, it's very amazing when I see around the world different NGOs, associations, companies, and so on, working towards sustainable development. And fortunately, the SDG, the 2030 agenda, really encouraged this, movement to happen around the globe because we are saying that now we have to localize. I really love this this word, glocalize the SDG that Ambassador Andrew advocates for. And you know, the health crisis is there for all of us, and it comes to my mind what in, you know, in even more than 20 years we are talking on health, on the access to primary and secondary health, the IEC, educate, information, education, and communication for health. So I think now it's the moment for us to really rethink what we've been doing as you know, professionals, as professionals from different, you know, from different areas of knowledge. If we are teaching properly the, you know, the information, the education, and the communication for health. Sometimes we have this, you know, this position of blaming. I see a strong pressure under the, you know, the medicals, the doctors, and so on. But I think if we don't change this paradigm of thinking that health has not only to do with doctors or nurses, but you know, different areas such as social service, sociologists, psychologists, you know, communicators, coach, they have, you know, a central role to play in health sector. You know, we should more and more make the, you know, the way we work on development for health, we should make it more democratic in terms of that's my feeling, that sometimes we give more, you know, we give more emphasis on doctors, nurses. Is true, because they are on the front office of all this issue. But I see that it's important as well to, you know, work more and more in education, communication. And now I see the role of schools, the role of teachers, the role of this, you know, CBOs, NGOs, because it facilitates the work of doctors. Sometimes, you know, my first major was sociology, and I had a teacher who used to say that when someone goes to a doctor, to a physician doctor, and the situation is not resolved, so he gives it back to the society, to sociologists and social workers and psychologists, etc. So it's really important, you know, for the healthcare system, the healthcare systems to pay attention that healthcare is a very multidisciplinary, you know, topic. And we should not only say this in theory, but in practice. That means putting, you know, budget, allocating budget for health, primary health, health prevention, you know, disease prevention, campaigns around the world. And we have now social media. That is, I think it's you know, a very strong tool that the health care system must have, because if you want to launch a campaign to, you know, to disease prevention, for example, how that people can, you know, live on, how they can take care of their well-being, how they can take care of their health. You really now have the tools. So giving more and more emphasis on the allocation of budget globally to IEC. I don't know if I am pronouncing it well in English, because, you know, when I work at the health sector, it was at UNAIDS ONUSIDA, it was in French. So IEC, Information, Education et Communication. But I think it's the same in English, information, education and communication. So it's really important to conclude, Ambassador Andrew. I think what you are putting in place, not only you, but Maria, Luis, Patricia, the colleagues, the ladies from India, and so on. It's very powerful because you are working with the population. You are working with the communities. If we don't work properly, if we don't invest in health, in community health, it will be more, difficult for the health system to not to enter into collapse. So I would really like to advocate for the primary and secondary health care. It's really, 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 really important that we more and more invest on communication, on campaigns that really help population, that really help youth, children, and so on, to invest in their well-being, because this guarantee the sustainable development, this guarantee the human rights, the basic human rights to health, the observance, this guarantee a better world. So thank you very much, Joseph.
Full presentation. Wow. We are in for it today. Yes. Okay. Let me bring in His Highness Prince Nathaniel Williams. We are here. We are all here to learn, I believe. Yeah. Over to you, sir.
Okay. Well, thank you so very much. I really certainly do appreciate that. In order to be able to share with you a little bit more, I did notice many of our guests here, our ambassadors here, are also from Nigeria. So I wanted to give special thanks again to the Easy Palace in Ghana, and also to the monarchy of Yaya, both of which are related to delivering services to the Igbo people throughout Ghana and around the world. So to proceed, Joseph, I'd like to share my screen, or could you share it? I'd like to share some information with the guests here.
You can go ahead, sir.
Okay. I know today's topic is about health and well-being, but my perspective and my expertise deals more with the fact of providing the interconnection, all of the sustainable development goals. They're all closely related, and we believe that Sustainable Development Goal number 17, Global Partnerships for Development, is in fact the one that has to be aligned with each of our efforts. What we've done is we put together a publication. It's online. I put the link in the chat because our objective here is to make sure we have a full engagement by not just our local people in the health care field, but in all of the related industries that have an impact on what we're trying to accomplish. For example, we invite all of you to join us as we grow and build a worldwide collaborative that accelerates the African Continental Free Trade Agreement. That is going to have a major impact throughout the entire continent of Africa. So we need to be able to relate what we're doing here to actually what's happening on the ground. Our objective is to recruit, categorize, register, mobilize, and empower another 10,000 business, interfaith, academic institutions, and others through the United Nations Global Compact local network. So we are committed to balance and hold accountable those 10,000 businesses whose impact is having an everyday impact on our lives. So Joseph, I'll turn this back over to you. Thank you so much.
Okay. Thank you so much for the presentation. Is that all you have to say, sir?
For me, yes, that's all. I put the information into the chat. There's a lot more information that I could share in 5 minutes.
Great. Let's hear from Ambassador Luis. Let's hear from Ambassador Luis. Are you ready for us? Good.
Yes, thank you very much, Joseph. In conjunction with what Andrew has expressed, We have been working very hard and diligently into promoting the United Nations programs and encouraging companies, nonprofit organizations, private companies also to engage in assisting us to globalize the SDGs, especially number 3, 17. But basically, all of the SDGs have to apply to each country, each community in developing and assisting our local communities and countries in making and creating awareness that if we don't take it into our hands to notify the people that there are programs that can help the communities come out of poverty, hunger, improve healthcare, improve the wellness of the children that are impacted so much from these epidemics that are occurring around the world. The COVID-19 epidemic has really caused havoc in the population and the wellness of all of the people. Children, older people have higher stress levels, have more preoccupation. Mental health has deteriorated greatly around the world. But we can make a difference. Activating local communities, activating advocates at the community level to promote activities, to promote programs that can alleviate that stress, integrate the elderly people with the younger people, have the elderly people that are in the houses support education and still be active in the communities. That is creating wellness in the population. Andrew and I and many of the group are developing and taking into account initiatives that we can implement in Puerto Rico, and LA is doing an awesome job with the communities, with the Black communities, with the African communities, integrating, making them aware that they are important, they are loved, and we need to take care of our people. In Puerto Rico, we have been devastated for the past 3 years. Hurricane Irma, Hurricane Maria. We have had earthquakes, the pandemic of COVID-19. We're a small island compared to the States and compared to Africa countries and communities. And our situation has deteriorated drastically over the past three years. But that doesn't make it that we can't provide initiatives that we can make a difference. Right now, Puerto Rico is going through a depopulation. We've lost more than 400,000 people in the past 10 years. Unemployment is high. Our poverty rate is higher than the States due to the government debacle, overspending, the bankruptcy. So we are in a critical situation, but that doesn't mean we can't make a change, as I said before. Us, DV17, Janice, Andrew, Maria, and all of the collaborators in these webinars have an important role to address the communities, share the programs, have the communities join us, and together we can make a difference in the world. It doesn't take much, just the willpower, diligence, resilience, but we can do it. I know we can do it. Thank you very much.
Thank you.
Thank you very much. Thank you.
That was a short, very precise and powerful speech. Yeah. Maria, Ambassador Maria, can you please have the mic, please?
Yes, thank you very much. Since the topic today is good health and well-being, I will talk about the connection between nature and health, because I strongly believe that there is a strong bond between these two. I believe that if we destroy our planet, we destroy our own health, and if we exploit nature, we risk our own health. And this means that I support SDG 3, good health and well-being, and the connection to SDG 15, life on land. And yes, I think a connection to nature is essential for human health and well-being. And as a representative from Europe, I can mention the network of protected national areas, the Natura 2000, Nature 2000, which I strongly support. And here in Sweden, we have 30 national parks, which I am truly grateful for as a citizen of the country. And this kind of protected areas, I believe we should support all around the world. And unfortunately, environmental protectors are threatened in many parts of the world, and especially indigenous people, who I would say are the strongest environmental protectors among us all. They really need our support in these challenging times. So that is what I really believe in, that we need to stand up for the protection of the environment altogether. And there are lots of scientific evidences that it is good for our health to be out in the nature, and that it has effects on the well-being of the human being, that it reduces stress and maybe feelings of anger or fear or other bad feelings, but instead increases good feelings like calm and peacefulness. And for example, here in Sweden, there is this kind of nature therapy, Shinrin Yoku, is becoming more popular. It means forest bathing and has its origin in Japan. And it is about connecting to nature and reduce feelings of stress, for example. And yes, this is something I really believe in myself, because I feel myself that being in the nature and being connected with the nature makes me feel much better. So exposure to nature makes us feel better, both emotionally and physically. And there are scientific evidences of the physical effects also, reduced blood pressure and muscle tensions, for example. So I think that we need to live in harmony with nature for our health and well-being. Of course, in cities, this is a great challenge. And maybe this is one important future occupation, architects really need to think green and sustainable nowadays, and find ways to keep nature and not develop the cities at too much cost of the nature, and keep the natural space and parks for the well-being of people. And there can be creative solutions like gardens in rooftops, for example. And of course, there is much technology within this area. So yes, that is about SDG 11, sustainable cities and communities, that we need to take into the account, the nature, take the nature into account when we plan the cities. And this is about the architecture, like I mentioned. And Patricia mentioned gardening. I think that is one kind of therapy also that have effect on our health and well-being. And there are good examples of garden therapy also around the world. So yes, I believe that access to nature should be a human right for all. And I welcome a discussion about this. I searched in the Universal Declaration of Human Rights, but I did not find anything about the nature, but I think this is very important. It should be a human right for all to get access to nature, I believe. So yes, I think we must let nature be part of solution for the health and well-being of us all as human beings. So with this words, I would like to thank you all for this wonderful webinar, and wish you good health and stay safe and happy always. Thank you very much.
Thank you, Ambassador Maria. We can't actually separate nature from health. Thank you so much. All right, let me bring to the mic Ambassador, okay, Dr. Patricia, please, over to you.
Good morning again, and thank you very much, Ambassador Janice, for this forum, and Joseph and everyone else who has spoken so eloquently and profoundly about the issues concerning health and well-being. I want to acknowledge all that has been said, and I have learned a few things. One of the notable things I have really, that has remained uppermost in my mind is what Ambassador Janice said about the health model moving away from being a simply doctor-patient relationship towards moving more all-encompassing, involving the social unit of the family, the village, the community in the promotion of health. This is, in a way, what I want to say here is that health is, it's the pivot around which everything in humanity revolves. If you're unhealthy, even if you're successful, you have a nice home, you have a good family, you have a good job, if you're unhealthy, you won't be able to eat well, you won't even be able to live well. So health is the key determinant of a high quality of life. But the actual situation is that over the course of the years, humanity has pushed health to the background or to the back burner. Governments have spent more money on providing arms, during the arms race, and spending money on prosecuting wars and defense, instead of spending money on healthcare. In the developing world especially, we are not spending enough on healthcare. So right now, health is coming back from the back seat, and it's now reasserting itself that, look, I am the key ingredient that the world needs for us to be able to enjoy the planet. And even with this COVID-19 pandemic that has surfaced, you see that the stock exchange, capital markets, businesses, all of them had to just stand and take a backseat because health became the priority. Entire communities, right now, at least 1 million people have died in North America from COVID. And all these things that have been happening, it has impacted on the economy and the society at large. So we've seen how important health is. and it's now brought it from the back seat to the front. And so it's important. It's good that we are addressing health and well-being, which is one of the SDGs, the third SDG, because it's very, very important and it is very crucial. And then I wish to even say that health is the pivot around which every other thing that we are addressing in life revolves. Without health, we cannot enjoy all the benefits of life that we see around us. The World Health Organization, right away, long ago in 1980, recognized that even the definition of health needs to change. Originally, health was looked at as an absence of disease or infirmity. You know, when you're healthy, it means, oh, you don't have a disease and you're not infirm. But we are moving away from that definition of just being an absence of disease or infirmity, but moving towards a state of complete physical, emotional, social, and mental well-being. This is where well-being comes into the definition of health. It is not just when you don't have a headache that you know you're healthy, or you don't have a growth in your body or sick, pains that you know you're healthy. You must be mentally healthy. You must have good relationships. You must be emotionally competent. So there's so many things that contribute to health and wellness apart from just physical health. So all these, the change in the definition of health, the change in the position and importance of health, all these show that we are being responsive to the changes in society. We are being responsive in the importance of the whole of humanity in the prosecution of health, moving away from just being a doctor or a nurse relationship towards everyone in the family, the mother, the father, the children, the grandchildren, and people in the society. Everyone has his place, his role to play in the prosecution and prevention of illness and the maintenance of health. So it's become very important, and it's almost like a ring. There is hardly anything that you will discuss that does not boil down to how wealthy, how healthy you are, rather than just how wealthy. So in this discussion of health, what I would like to add is, what do we need? Since health is so important, so since without health we can really, really do nothing, what do we need? How do we move towards ensuring that health is maintained and wellness is maintained? Some of the things we may need to do as a society, or as governments, or as NGOs, or as people in charge of advocating for better and healthier societies. Some of the things we need to do in our advocacy or in our budgetary responsibilities is to move health services towards the needs of the population where we are. Like, what I want to say is, in the developing world, for example, there are specific priorities in health that are geared towards eradication of infectious diseases. And even now, although they are now moving towards a higher burden of non-communicable diseases. So the emphasis in health spending should address the local concerns of the community. Like Ambassador Lewis talked about in Puerto Rico, the hurricane and the flooding. The health needs are very, while there are generalized health needs, there are some local health needs that each community has. So the assistance and the advocacy should address the population needs. So the services should be needs-based, so that we do not become irrelevant. If we offer a society or a population something that does not affect them, or something they cannot relate to, the population will not key into the help that we are offering. Another thing also is that the health services should also be measured. So in this respect, there are certain health indicators that we need to use to assess the health of a population, like life expectancy, like mortality rates, like under 5 mortality rate, like maternal mortality rate. So whatever we are doing, we should use these health indicators to measure our progress, so that we know whether we're moving forward or backwards. Another thing we could also do is to ensure that our advocacy, our health promotion activities are interprofessional. Like as Ambassador Janice said initially, that it's not just a doctor or nurse thing. The health team now includes the parents, the teachers, the grandparents, everyone in society is involved. Even with COVID now, we have seen that the media is involved because everybody is preaching social distancing, wash your hands. Everybody has a part to play. So health is now no longer just the responsibility of the frontline worker or the health professional. Now it's a multi-sectoral or multi-professional responsibility that is integrated and coordinated. The only thing now is that the health professionals will regulate and direct and guide the administration of the health systems and the health information. Also, health services should be accessible. It should, so everyone needs to have access. We know that in some, especially in developed societies, there's the issue of a lot of the population not having health insurance, so they don't have access to healthcare. This should be remedied. Health should be accessible to all, and there should be some way of making it equitably distributed. So there should be some benchmark below which everyone can at least access a minimum level of healthcare. It should also be accountable and efficient and culturally acceptable and safe. So these are some of the things that I think we need to do. Another thing I would not want to forget also is that the governments try to increase their budget allocation to health. Now that health has come from the backseat to the front, the governments also need to rise to the occasion and realize that what we have been spending in the past, especially in the developing nations, is far below what is required. So the third Sustainable Development Goal of health and well-being aims at globally improving everyone's health and well-being in the world, irrespective of age, race, sex, or income. So health is now at the forefront, and it is, like I said, it's the center around which everything revolves. So as we're advocating, we should leverage on the events of the past year to make our voices louder and make everyone have a seat at the table, since we are all stakeholders. I wouldn't want to overflog the issue, but I'm really very grateful to have had this opportunity to lend my voice to this very great and important discussion. Thank you very much.
Wow, thank you so much, Dr. Patricia. The session is always loaded. Thank you so much for that. All right, let's bring to the mic Ambassador Lynn Ujagwe. Are you ready for us? Unmute your mic.
Yes, I am.
Good.
Hello, can you hear
We all
me?
can hear you. We all can hear you.
Can you hear me?
We can hear you. Please go ahead.
All right. Good afternoon once again. All right. Good afternoon, everyone. It's a pleasure to be here. Thank you so much for this opportunity. I really appreciate it. The world needs joy, the planet. And then being someone involved with education, I think young people are also needs to be educated about nature and how it results to their good health. So I'll just go quickly to some things that education can do to help us achieve goal 3. So how we can link goal 4 to goal 3. Without education, we'll still have health issues back to back. So if we can start from the grassroots education to let young people know, to educate our communities on how to take care of themselves, how to live healthily, then we'll be able to achieve goal 3. So I'll just go through just a few pointers of the role of education in achieving health and well-being. With education, we'll be able to young people the conceptions of health, hygiene, and well-being, including an understanding of the importance of gender in health and well-being. Education will help young people to understand facts about most severe communicable and non-communicable diseases and the most vulnerable groups and regions concerning illness and how to prevent them. Education helps them understand the importance of mental health and negative impacts of behaviors like xenophobia, discrimination, and bullying, emotional well-being, how addiction to alcohol, tobacco, and other drugs can cause harm to health and well-being. Education will enable young people to have relevant prevention strategies to foster positive physical and mental health and well-being. sexual and reproductive health, and information as well as early warning and risk reduction. Education enables people, young and old, to interact with people. Education gives the confidence and encourage promoting health and well-being for all. Education is an eye-opener to create a holistic understanding of a life of health and well-being, and to clarify related values, beliefs, and attitudes. With education, young people can stay away from cultural practices that could harm their health. Education helps people to develop a personal commitment to promoting health and well-being for themselves, for their families, including considering volunteering or professional work in health, and publicly demand and support the development of policies promoting health and well-being. There are also things we can do to help promote education so that we can achieve goal 3. We can set up as people that work with non-governmental organizations and in our grassroots level and in our communities. We can also set up, oh God, not now. We can also set up, can you hear me, Mr. Joseph? Hello?
Yeah, we can hear you.
Can hear you, please go ahead.
Hello, can you hear me? You can? Oh, hallelujah. Okay, so we can set up information stands in our community. December 1st is World AIDS Day. So we can start sensitizing people about these things and then to help people in our community and the grassroots level to understand, to have education of basic things that they can do to keep themselves safe and healthy. We can also host videos in small groups to talk about promoting healthy behavior, things we can do without so much cost or anything. We can organize ethical and reflective essay writing for young people to discuss about their health and their well-being. We can organize workshops with storytelling by people who have suffered from illnesses or who have recovered from drug or abuse. This will also make people to know that, okay, if this person survived, I can come out openly and I can get help. We can also organize trainings on health, promoting good health, good lifestyle, exercise, and anything that will generate to global health and well-being. Thank you so much, everyone. I hope I've been able to make a point. Thank you.
Yes, you have been able to convince us and not confuse us. Thank you so much. Yeah, yes.
All right, thank you. I'm grateful for this opportunity. Thank you so much. Thank you.
Yeah, I want to bring to the mic Dr. Sonali. Dr. Sonali. Oh.
Yes, thank you so much. Can you hear me?
We can hear you.
Okay, thank you so much. I was really impressed and I was enjoying and learning so much the information from the previous speakers. They are wonderful, and I couldn't write anything, any response because of I'm actually listening whatever you people are talking about. Thank you so much. So actually, as I told, I am in holistic health conservation. It's all about, it's an idea about coming from our wisdom tradition, Indian wisdom tradition. So in which we, as everybody was discussing, is that health issue is not only now is the matter of doctors and nurses and the frontline workers, as Ambassador Jenny was talking and other also. So this is the quite, important point now, that how we can bring it in a practical lifestyle. So we are concentrating on practically how people are, apart from treatment, how other things they can adapt in their life. So we are concentrating on that, and for that we actually give, we in the sense like our traditions, yoga, meditation and Ayurveda always talks about practices, because some of the things, like if you have physical ailments, you can get for treatment and you can get better. But if you have mental problem, for that you need practice. So without practice you cannot eradicate the mental problem, because mental problem is happening in a non-local section of our body. We cannot see where is the problem because it's non-local. We have to understand through your behavior, through your nature, through your lifestyle and all. So we concentrate on that part, how we can get into that, how we can help people to understand what is your problem regarding your health. So in this way, holistic health conservation constitutes a total body, mind and soul connection, as well as treatment, in which so many practices are there. Like for body, physical practices, we have yoga. For mental practices, we have meditations, breathing exercises, and also some other practices. Apart from this organized practice, we also concentrate on practice of gratitude, practice of healthy emotion, practice of kindness. All these things are nowadays is being practiced, but it is not from the soul. So how people can connect with soul with all these emotions and practices, we always concentrate in our workshops, in our schools. As I told you, we are running underprivileged schools, and as you know that they are having so many diverse culture, the people who are staying in slums and all. But we applied all these things to them, and they show a drastical change in their lifestyle as well as their family lifestyle. Although they are not able to understand the actual theory of holistic healing, but we practically make them understand by doing so many activities every day, like practice of gratitude, practice of thanks, practice of kindness, and how you should treat people politely, how you should keep your mind peace. Without peaceful mind, not a single disease is going to be treated. So first of all, we generally if it is not a physical problem, obviously if you have fracture, you have to go to the treatment and all. But if you have a kind of problem like stress, anxiety, dementia, Parkinson, we always counsel them, and we have got so many good results out of that. And so many children, those who are having some mental illness and some physical challenge even, they have shown good results out of these practices. So we are we are advocating this practice all over the world. People are connecting with us, and they are asking for so many things. If they have any kind of problem, they're not able to understand, they immediately ask us. Apart from their medical treatment, they are also practicing our counseling, our treatment, and they shows always good results. So I just wanted to spread this message that not only the frontline health worker, but we as Ambassador Jenny was actually talking about, now it need to be so many people in the inclusion, like psychologists, sociologists. They should always be side by side with the community, because nowadays problem is much more serious mentally than physically. People have found lots of machineries and so many equipments to treat our physical problem, but mentally we need lots of works, and we are very hopeful for that. So many organizations are working all over the world, and we are getting so many cooperation also. And I also thanks Janice for her cooperation and help. Thank you so much. I hope I can bring forward my point of view with all, and I would like to coordinate further with my concept in near future. Thank you so much.
Thank you. You're welcome. That's a beautiful one. All right. I think we have Ambassador Chris Nyabo. You're welcome. Please take over the mic, introduce yourself, and let's have your presentation.
Thank you very much. I am Ambassador Christ Nyembo from Democratic Republic of Congo, and I'm so happy to be here, and I'm grateful. Please, can I speak in French?
We don't understand, but speak and interpret.
Yes. Miss Ambassador Janice can translate.
Merci, vous pouvez parler. Je ne sais pas si tout le monde va vous entendre, mais en tout cas, soyez libre pour parler en français.
Vraiment. Donc, j'aimerais me sentir libre. Tout à fait. Merci beaucoup. Sinon, comme je le disais, je suis l'ambassadeur Christ Yembo de la République démocratique du Congo. Je suis coach en leadership et puis développement personnel. Et je fais pas mal de choses. Sinon, par rapport à la question qui a été donnée, je pense que nous devons remettre beaucoup de questions sur la table, en particulier la question liée à la santé publique ou encore au système sanitaire mondial. Parce que nous avons compris que avec l'avènement de la COVID-19, nous avons compris que le système sanitaire mondial était vraiment un passoire. Il n'y avait pas de garde-fous pour réellement lutter concrètement face à la COVID-19. D'où nous devons créer, moi je propose à ce que nous puissions créer un nouveau système sanitaire qui sera très efficace par rapport aux questions liées à la santé publique. Parce que, par exemple, en Afrique ou en RDC, où je suis pour le moment, nous avons une carence par rapport d'abord à l'éducation. L'éducation, lorsqu'on parle de l'éducation, c'est-à-dire sur le plan sanitaire, il faut renforcer cette question-là. D'où nous devons passer par des collaborations qui seront très prometteuses, qui va promettre à ce que le monde puisse marcher sur le même pas d'égalité, c'est-à-dire les informations que les Américains ont, ça doit descendre, avoir une échéance jusqu'à descendre vers les pays de tiers-monde pour que ça puisse vraiment nous aider. Déjà, en parlant de problèmes sanitaires, nous devons comprendre, nous devons commencer par lutter, nous devons commencer par mettre fin ou à lutter contre le véritable problème, c'est-à-dire comprendre pourquoi les gens sont malades, pourquoi le système est défaillant, pourquoi il y a toujours des problèmes ici et là. Parce que je pense humblement que avec les systèmes les systèmes de santé actuels ne permet pas à ce que les gens puissent se mettre dans un état d'aisance et de bien-être. D'où nous devons comprendre qu'il y a des problèmes majeurs que nous devons premièrement commencer à résoudre, c'est-à-dire des problèmes liés au mental, parce que la majorité des problèmes ici, c'est d'abord le mental, c'est lié au mental. Pourquoi le mental? Parce qu'il y a des conflits, il y a des problèmes liés à l'environnement. L'environnement n'est pas propice pour avoir une bonne santé. Je ne sais pas si chez vous, il n'y a pas la pollution, mais il y a la pollution qui gangrène du jour le jour la population, la santé du monde. Nous devons travailler ensemble pour mettre fin à cette problématique-là. Nous devons vraiment fournir des efforts pour mettre fin à cette problématique, mais également à mettre en exergue un système d'échange qui va permettre à ce que tout le pays du monde puisse bénéficier des échanges, par exemple de l'expertise de certains experts de la santé. Par exemple, je donne un exemple, j'ai été en Inde, j'ai compris qu'en Inde, il y a une sorte de thérapie qu'on appelle le yoga. Vous pouvez utiliser le yoga pour vous sentir mieux. Mais par contre, en Afrique, par exemple, le yoga n'est pas vraiment assez pratiqué. D'où, il faut une très bonne coopération entre États pour que nous puissions faire des échanges, qu'il y ait des échanges des pratiques, d'expériences, des échanges de méthodes qui pourront aider les autres. Il y a également une autre problématique qui est liée aux maladies. Par exemple, l'Alzheimer, le Parkinson. Ici, en Afrique, ce n'est pas vraiment que ce sont des maladies pas assez connues. Il y a des gens qui en souffrent, il y a des gens qui en meurent, mais qui ne savent pas réellement la source et comment traiter. D'où il faut passer à un échange de connaissances, à un échange de pratiques, à un échange comment on appelle, un échange de pratiques, de méthodes entre spécialistes de la santé, entre États, et puis trouver comment financer le système, le domaine sanitaire. Parce que la santé aujourd'hui, ça devrait normalement être la priorité. Heureusement que docteur Patricia l'a bel et bien souligné. Nous devons faire de la santé aujourd'hui une priorité pour le bien-être de tout le monde. Pour le bien-être de tout le monde. Et pour ce faire, il faut mettre le moyen. Il faut vraiment créer une structure qui sera capable de maintenir tout le monde en bonne santé et que tout le monde se sente à l'aise de vivre sur cette terre. Parce que, hormis ça, il y a plusieurs problèmes. Les problèmes liés à la malnutrition, les problèmes liés, il y a des problèmes liés à la malnutrition, il y a des problèmes liés à la mortalité infantile. Il y a des femmes qui meurent chaque jour, il y a le VIH. Il y a beaucoup de problèmes. Il y a la tuberculose, il y a le paludisme qui tue plus que même le coronavirus. Nous devons trouver des solutions idoines. Nous devons vraiment chercher à fournir nos efforts, que ce soit financiers, matériels et expertise, que nous puissions travailler ensemble pour éradiquer ces problèmes, afin que le monde puisse vivre dans un climat de paix, dans un climat de bien-être, dans un climat d'harmonie. Donc, je crois que la coopération, c'est une très bonne chose. Nous devons coopérer dans le bon sens. Nous devons échanger des pratiques, des méthodes, d'expertise pour aider les uns et les autres à se développer, pour aider les uns et les autres à marcher dans le bon sens. Sinon, ça a été un réel plaisir. Je pense qu'il y a plusieurs choses à dire. Je pense que l'ambassadrice Janice pourra nous offrir une seconde chance pour revenir, afin de parler et puis de parler pour chercher à trouver des solutions pour notre humanité, notre terre. Je suis très, très, très content. Merci beaucoup. Je vous remercie. Merci.
Merci.
Merci. Merci,
Merci.
ambassadeur.
Merci beaucoup.
Merci, ambassadeur Krast.
Thank you. Merci beaucoup.
C'est que la première rencontre de la série de santé et coopération pour la santé. Donc, vous êtes invité pour toutes les autres rencontres qui seront faites bientôt. Merci, merci. Thank you. So, Ambassador Christ was, you know, highlighting the importance for cooperation, the importance to cooperate. He mentioned the yoga that is, you know, something that is really common in other cultures and in other countries. He mentioned that it's not used in Africa. That is why, since yoga is known as one of the, you know, great methods for the health and well-being. So he is advocating that we cooperate more and more with Africa to bring those, you know, best practices to Africa. And he highlighted as well the need to think on the new health system. So thank you, Ambassador Christ, for adding your voice. Thanks.
Thank you.
Over to you, Joseph.
Yeah, thank you so much once again for the privilege. Okay, let me bring to the mic Dr. Loretta. Dr. Loretta, are you available now?
I am here.
Good. Welcome.
Can you hear me?
We can
Yeah.
hear
I
you
don't want
clearly.
any noise. Yeah, please, I'm not a doctor, meanwhile. No, I'm not a doctor.
Okay. Okay.
I just work
Your
with
title.
NGO, and we are, whereas we work on health is one of our focus areas, and we actually do a lot of community work on, outreaches and education. I agree that actually education is key, but I also agree more especially that outreaches to the local communities is most important, because during our outreaches we have found out that a lot of people actually want to go to hospitals, but they do not have money. So what do? But when you go to all these outreaches, you're able to, diagnose some of their, because we actually go with medical personnel, and we are able to diagnose their ailments, and we're able to give them some kind of medications. But importantly is the high out of pocket expense on health. So when we talk about health issues and how we can resolve them, we have to start looking at the universal health coverage. How can we help the poor people? How can we alleviate their issues? How can we assist them to have a holistic, health situation or condition? Just like every other person has spoken, is important really that we look at it holistically. So how do we go about ensuring that the common poor people in rural, very remote, out of reach communities can actually access this? Yes, like in my country, in Nigeria, we have so wonderful policies on health, so wonderful laws, but the implementation has always been the problem, especially when the terrains of those people are very bad. Nobody wants to go there. I have worked in communities where I had to go to monitor immunization, and I found out that health workers could not go to work because they felt those areas are hard to reach. You have to be on a bike for like 2-3 hours before you can get to such communities. And when it is rainy season, you can't even access them at all. So how do we do this? How do we get to these people? How do we ensure that they get all the health facility and health care they need? When we tried also to institute and establish some community agents, health agents to work around immunization, but it is not enough, because they can still not come out to assess the vaccines in the primary health care where it is closest to them, maybe the ward health care where, primary health care where they need to get the vaccines before going back to their communities to go and administer it. So how do we go about that? What do we think we can do? What can I understand that, because of cooperation, some organizations like Gavi, like International Vaccine Access, they are doing their best, WHO, to make sure, UNICEF and all that, but it's not enough, because those communities are still without health care. What do we do with this cooperation we are talking about? How do we go about it? Because it is the foremost thing. If those people are the communities, the remotest communities, cannot access healthcare, then we can't say that we are going to succeed. We can't say we will succeed until they can access basic health care. Until they can't do that, then we cannot say that we have won. SDG said, leave no one behind. And these communities constantly are still being left behind. So government, corporations, industries, big corporations need to assist, NGOs, basic NGOs that work in these communities, because we know we have political NGOs that just be NGOs by word of mouth. They do not go to communities. They do not know what the common men or women are suffering from in those communities. I have been to those communities where children are having enlarged spleen simply because they were not able to treat malaria. They were not able to treat as common as malaria, because in Nigeria, we see malaria as one of the commonest diseases, but still, it's killing people by the day. How many millions are dying from malaria every day? So how do we get to this community? That is my own focus. community outreach. It is very important. So until we integrate it seriously into all the health policies and make sure that all the health policies that are being domiciled in the national, in the state, get to those communities, then we have not been able to achieve anything. Then SDG is not doing anything, because across board, SDG has made it known to us that collaboration and partnership is what is going to help us. And now Ambassador Janice has just brought about this cooperation on health and well-being. How do we make sure? Because, okay, when we even talk about the physical health, we talk about also, we forget the mental health, the psychological effects of whatever these people are passing through. How do we assist them? So for me, education is key. Yes, we continue to advocate, we continue to sensitize them, but they also need counseling. They need psychosocial counseling. They need support, medical personnel support. And most times you go to these primary health cares in those communities, no doctors, no qualified nurses. What we have there are just community trained health workers. And how far can those people help? They can only assist, and they have limitations to what they can do. So we have to really start looking into what we can do to those remote communities, because us in Nigeria, our worst problem is those communities, because our terrains are very, very bad. We have very bad roads, and these people cannot be accessed. But when it gets to election, somehow our government reach them. So to building political amassing political critical mass for elections and all that, our people, our government find a way to get to them. So why can't they get to them with health? Why can't they get to them with all the health facilities they need, with all the medical personnel they need, with all the medical assistance that can be rendered to them? And we also talk about food system. And then when we talk about food security, how much are we actually helping these people to eat healthy? Nutrition is also another key area and key point that we need to look into to make sure, to ensure. Hello, am I being heard?
We can hear you.
Hello?
Please go ahead. We can hear you.
Hello? I can go. Okay. So nutrition, make sure to ensure. Head. Hello? Okay. So nutrition. Okay. Nutrition, do we assist this? Know that in those communities, because of high out-of-pocket expense, you don't see them going to do a lot of things. But also we try to encourage them to use what they have, the natural things they have. I heard Maria talking about nature. Yes, there is so much endowment in Africa, in Nigeria more especially. So many vegetables that can help. But how do they know? I know that they have indigenous knowledge that also has been assisting them, but also sciences and technology and civilization has also brought about other vegetables and plants that can actually assist. How much are we impacting on them to know that these vegetables are key? Because they can eat our staple food, which is cassava. They eat it morning, afternoon, night. The most important thing for them is for them to eat and feed and be full and be filled up, and not just, they are not looking at the nutritional value of those things. So we need to really look into the nutritional aspect of the life of these remote people, because if we do not do that, then whatever we are preaching at the national, at the global, at the regional, at the state level has no meaning. And the key ask, the 6 key asks for the UHC is very, very important. Leave no one behind. One, ensure political leadership that is beyond health. Ensure political leadership. And when we talk about this political leadership, we are talking about UN 75. They are there gathered. And we are talking about COVID. And a lot of them are talking about how they are going to be financing big corporations to go back to doing their activities that has been infringing on climate change and environmental adverse environmental impact. That is what they are planning. Are we adding our voice for them to understand that we need political leadership that will ensure that health gets to the least person in those remote communities? Are we talking about regulating legislations that can assist us get to those areas? legislations that will go beyond the national, that will go beyond the regional, that will go beyond the global? Are we talking about moving together to establish multi-stakeholders mechanisms that can continuously engage these people, irrespective of where they are? That is why SDG said, leave no one behind. Whether that person is living with disability, whether that person is living with HIV, whether that person is living with COVID, whether that person is living with diabetes, whether that person is living with any of these, cancer more especially, is another non-communicable disease that is actually so prevalent now all around. If you go to the communities, when we did cancer screening, we saw a lot of women with cervical cancer. We saw a lot of them with breast cancer, and nobody is assisting them. They don't even know what to do with this. Instead, they will call it spiritism. They will think that somebody is after them, somebody is after their life. Yes, I agree, such things will happen because
Well, I think we lost. So sorry about that. Is she back? Okay, she's back. Please unmute your mic. Oh. Hello? Okay, all right. If we can still connect with her, maybe she would conclude on while doing the rounding up conclusion. Okay, lastly, I think I have Dr. Amnon. Is she on seat? Oh, she's not on the call.
Because she had to, Joseph, she had to run to the hospital to see a patient.
Okay.
Yeah.
Okay. Okay. Right now,
running up to Blessing.
Yes.
And Loretta will come back and she will conclude because she was saying so many important and strategic issues.
Very, very informative. Yes, correct. All right. I want to bring onto the mic Madam Blessing. Are you on the call? Good. Welcome.
Thank you so much, Mr. Joseph. Can you hear me?
We all can hear you. Please go ahead.
It's really, it has been an educative session with you all. I've heard from great speakers about how we can bring about health, good health and well-being in our society. And I really must say that I am greatly informed. I've learned a whole lot of new things about health and how I can, in my own way, carry this, transfer this information to the necessary groups as much as I can. Thank you so much for all that you've shared, especially in the part of inclusion, that health is everyone's business. I really agree with that because the SDGs 17 talks about partnership for the SDGs, that everybody has to be involved. And speaking of involvement, I was also thinking this has really been a thought of concern for me, promoting health in the workplace. I know that there is a policy, or should I say, called the Occupational Health and Safety Regulation to promote health and well-being in the workplace, but I don't know how many of our workplaces are executing these policies, especially in private workspace or personal businesses. And when we're talking about this occupational health and safety, we may not really only be talking about dangerous chemicals or gases that may be impediment to our health. What about our mental health too? Because everybody works. I mean, even if we have people that are unemployed, an average household has one or more persons that are in employed or in the business space. So even if you own a business or you're employed to an organization, you are actually in a workplace and there are work conditions most of the times that are not beneficial to health. Some of these work conditions, it's really hard to discuss it because people don't take data on things like this. You know, we are talking about promoting health, and then you go to work and you're being put under, subdue pressure to be able to deliver a task beyond what your normal capacity can carry. And since we are all talking about work productivity, success stories, we sometimes forget about our own health. I could recall once when working with Save the Children, the um, the staff, people involved in the project were actually out to promote health in the communities. But I also realized that the workload on a person was so huge that at some point some of the staff started depreciating as a result of the delivering on the project. So I got to ask them, we are out there, teaching about health, talking about health, but we are working as staff and it's turning back on us like our health is not good. So how can we give what we don't have? So it means the work condition surrounding us, it's not promoting health. So this, it comes in various forms. Some of it is, affecting mental health. You know, the way some employers deal with their employees and, the emotional trauma and the rest of that they get to put them through. Some people get to be laid off work without any form of consideration as to whether this news is going to affect their health status, as in if it's going to get people depressed. So these problems, I believe, has been, affecting our workspaces, even our personal businesses. Like when you're executing or carrying out your business, are they, do you follow the health procedures? I know we all want to achieve, we all want to make profit, we all want to succeed, but do we look at if the approaches that we are putting in place supports and promotes our health? Because if it doesn't, then we are actually putting ourselves at risk. So we cannot really say how many health conditions have actually, should I say, come out of the workspace because we don't have data, we don't have reliable data to support that. But from our observations, we realize that in work environment, in most cases, it does not promote health. So maybe we should also look at those regulatory frameworks, especially the occupational health and safety regulation on how we can execute this. It should be part of our deliverables. I think health checkups too in work environment, how you're doing your job and your tax. Is it telling on you? Is it affecting your health? We should also look at that. I believe that also is going to help improve the health and well-being of societies, because globally every family has one or more persons that is engaged in a business or is employed in an organization. So that's my little contribution. Thank you very much.
Thank you, Blessing. Thank you very much. Unmute yourself, Senor Joseph.
Well, sorry about that. I want to bring back to the microphone humanitarian Loretta to round up our presentation in few sentences so that we can round up this session.
Okay, thank you very much. So sorry about the network connection around here. Actually, I was rounding up already, and what I actually wanted to now, summarize is that no matter what we do, no matter what we plan, if we do not cascade, if we do not step down to the remotest of the communities, if we do not carry everybody along, just like the SDG has advised, that we leave no one behind. If we do not do that, then all our plans, all our implementations and executions will not have worked, and we cannot give ourselves pass mark. And I heard Blessing now talking about data. Seriously, data is very important, because even with all these community issues I have met on my community outreaches, how many people have come to us to ask for data? And even when some NGOs also do not believe in going to government to give data, because they do not also care to ask us for data. They sit in their offices and fabricate numbers. If we can look at data, these community-based organizations, what they are doing, because at every point we have our outreaches, there is a data, attendance sheet and all that. And when we come out, we do a report, we send to government. How much do they integrate those reports, to health facilities? How much, I do not know. But all I know is that data is important, and those outreaches are most important. So all the corporations we are talking about, we all need to come together. Our effort, collective effort, is important, especially at this COVID time that the pandemic has hit hard on everybody, irrespective of where you are. Everybody is feeling the impact. Dr. Patricia spoke about, the financial implications of what pandemic has done to global economy. It's hit everybody. So you can imagine how it is with those hard to reach communities at this time. It is really, really very bad. So Ambassador Janice that have put this together is wonderful, but please let our contributions go back to UN, let our contributions go back to WHO, let our contributions go back to all the UN agencies, and let it go back to all the government leaders, the world leaders, and big corporations, to see how they can come together to assist in making sure that the most remotest people have health facilities, that their health conditions are improved, by also assigning more people go to those communities. Because most times also logistics stops some NGOs that want to go there from going there. How are we making public finance available to people that are ready to work, and not for those that want to put our public money into their private pocket? Thank you very much, Joseph, and thank you, and Ambassador Janice, for this wonderful opportunity, and all the speakers. You guys have been wonderful. I really enjoyed myself. I also learned a lot, and I'm sure my little contribution also made impact. Thank you.
Yeah, thank you so much. Thank you so much. Thank you so much. That's a wonderful one. Over to you, Ambassador Janice. And I want to bring back Ambassador Janice and His Highness Prince Nanan Yao Williams to both give us a rounding up kind of conclusion to this session. Thank you.
Thank you, Joseph. Thank you, all of you. Wonderful, for your wonderful words, for your speeches. This is really an opportunity to advocate for health, for the basic human rights to health and well-being. I would invite you to go to our chat and check all the, Ambassador Andrew, Joseph, and other colleagues, Ambassador Luis. We've been, sharing different links that we think are important for all of us to go and visit and see how they can be, useful to the work you are doing. To tell you as well that this is the first conversation on health, and I am so delighted with all your inputs. Thank you very much, and hope to see you again soon in another meeting. I think, Joseph, I think it's the next 7th October. At the UN the month of October, it's the urban month because it's the month to advocate for the SDG number 11 that has to do with a sustainable, resilient, safer, and inclusive cities and communities. So we invite you as well to advocate for the SDG number 11 implementation, because the growth is definitely urban, and we should more and more promote health in the rural, but also in the urban area where the majority of the population of the world live. And thank you very much. I will give the floor to Ambassador Andrew. Thank you, brothers and sisters, for coming, and hope to see you again on the next 7 October. Thank you very
Thank
much.
you. Thank you so much. Thank you.
Thank
Well, certainly.
Thanks.
Thank you so much,
You are
Janice.
amazing. You are amazing.
Thank you so
Thank you
much.
so much, Janice. We really appreciate everything you've done to bring us together. And namaste. We do want to let you know that in the chat, we're actually addressing many of the issues that we brought here today. We believe that working collaboratively together with not just the governments, but as you say, with that are in the community, that means not just government agencies, it also means our tribal leaders. As you know, throughout Africa and throughout many parts of the world, it's the indigenous leaders that are able to reach those people that are furthest and most remote. In South Africa, for example, my goddaughter there, Debbie Mutlong, is working with rural women on a daily basis. So in the chat, I put in the link. We hope you'll go to the Saga Foundation. We're registering nonprofits. So many of you are from Nigeria. So they'll be working directly with organizations in Nigeria to register you free with the United Nations Global Compact. That's the largest corporate social responsibility organization in the world. But we believe it's important for interfaith as well as civil society to join the organization so we can balance and hold them accountable. So the change has to come from the bottom and the top. We thank you so much for participating with us. You can find us on Facebook. We have our Counter Think Tank Facebook page, but Ambassador Janice can connect you with us. Look forward to working with each and every one of you. Thank you so much, Joseph Akinola, for making sure that we were able to have this presentation. So thank you all to our guests. I really do appreciate all of you and love you.
Thank you so much. Once again, I'm thanking everyone for coming on board and showing up for this event. I greatly appreciate that. And on behalf of Ambassador Janice, we both greatly appreciate this once again. Yes, please, I want to drop this information. Please, let's keep the trend flowing. Let it not stop here. Yes, let's not stop here. Once again, there are a whole lot of resources for us in the chat room, which I think each and every one of us can still see one or two things to pick from. Thank you once again, Ambassador Janice, for the privilege, and thank you for putting this program up with all. Let us behind, because that's the code of our connectivity. Let's leave no one behind. Yes, let's leave no one behind. On this note, this program comes to an end. Thank you so much for showing up. Thank you so much, Ambassador Janice. We greatly celebrate and honor and appreciate your time. Thank you.
Thank you, everyone. Thank you. Bye. Thank you, Ambassador Janice.
Thank you. Thank you.
Thank you.
Bye. Bye.
Thank you, Sonali.
Thank you. Thank you.
Thank you. Thank you so much. Thank you. Namaste.
Namaste.
Thank you. Namaste. Namaste. Thank you.